Aloha, I'm Dr. Brian Stolley with MediSpa Maui and the Stolley Center. Today I have Naomi here with me, and Naomi is, she came in a little bit earlier today and told me a couple of different things that were bothering her, and I wanted Naomi just to sort of discuss them with me again, here on camera even, and so you can just kind of go over those with me if you don't mind.
Sure. So I wanted to do a little bit more fullness in my lips. Also under my eyes, I feel like it's getting a bit hollow, and the dark circles are bothering me, to kind of fill in there, and then possibly do some filler to lift.
Okay.
And then also some Botox on the top here.
So I want you to frown for me. And you can kind of just turn your head this way just a little bit here. It's kind of towards the camera. So if you can frown for me, raise your eyebrows up. Good. Close your eyes tightly for me. So, okay, good. So we can treat the frown, the forehead, the squints. We can treat the bunny lines here. We can put a little Botox around the mouth too. I think your lips are very nice, but a lot of women even, they have nice lips, but they want them a little bit plumper, so that's kind of what you're asking. I think you look lovely, but again, you're wanting a few different things. You're noticing a few things. Pucker for me. So we can put a little, relax, you can put a little Botox around the mouth that can help, kind of help the lips roll out. Sometimes when patients, they feel like their lips they just want a little bit of oomph, a little bit extra plumpness to their lips. Sometimes I'll just do Botox, and that'll help them roll out. We can pucker for me again. You're not really good and relaxed. You don't really have it, but if we see a little roughness in the chin, we can use some Botox in the chin as well. For people who are grind, or if they're getting kind of like full out here because of the muscles are hypertrophying, or getting bigger, we can use Botox in their masseters. And another area we can use Botox is down the neck in the neck bands. Can you go E for me? So these right here, we can treat those neck bands and kind of soften them up and put a little less tension on the skin, so that you kind of age slower in that neck region. Back up in this, thinking about aging slower, another good place to use Botox is back up in the squint. We can kind of prevent those deepening lines that we get over time. Close your eyes tightly for me and relax. And Naomi, you've been doing Botox for how long now?
15 years.
15 years, and how old are you?
35.
35. Oh, there, we heard it there. Oh, I see little wrinkles in the chin now. I made your chin wrinkle. So you've been doing it since you were 20, is what you're saying, and I don't see many wrinkles here at rest. So that's sort of a testament to kind of a Botox over time, doing incrementally over time. It does help us age slower. So that's one of the things that I really like about Botox. So back to your assessment and kind of evaluating you. We've kind of reviewed the Botox, and I want to talk about the filler. Sort of in that under eye area, I can see how we can put some filler in that area. I often use a kind of a layer technique. There's 3 different depths where we can put that filler down deep, right along the orbital rim in this mid region, and actually more superficially. And I'll consider using different fillers in those different regions. And so this is also an area where, unfortunately, people can bruise. People can get black eyes and things like that. We can bruise anywhere, but the negative is a small bruise in this area can turn into a black eye. So that's one of those challenges there. The cheek area, I have a technique where I can just give a nice little lift to that cheek area and relatively few pokes. So that's nice. And the lip area, when I'm using fillers, a lot of times in the lips I'm using Juvederm. So sometimes we'll use another product called Velour and Volbella, and there's a Refine. These are all products that work quite well on the lips. I'll often just come from the sides, and I'll use a cannula so we can get a nice lip correction with just one poke on the up and one poke on the lower lip, and so we can do 4 little pokes and treat the entire lip region. So that's kind of nice to do that. Now we can get more creative with fillers. We can come from above and try to get more eversion or rolling out of the lips. Anytime we're doing more kind of advanced techniques, there's higher risk of bruising too, so we have to be mindful of that. So those are kind of the things that I could see doing for you, and then in a moment we're going to get started. Down for me, and then relax. A little poke. And bite down again and relax. Treating her masseters to soften her, weaken her jaw muscle so she doesn't grind, and it kind of flattens this area out. Tighten up for me again and bite down. Good, and relax. First anguli-oris. Pull your corners down again and relax. Treating that muscle that pulls those corners down so we can soften that. Okay. Bite down for me again and then relax. Poke. Bite down again and relax. Bite down again and relax. And relax. Relax. Good. Look up for me. Straight up, up, up. This is going to be a weird one. Okay. That's a tough one there. Look on the other side. Close your eyes tightly for me and then relax. Look up for me. Treating the hypertrophic orbicularis oculi. Say that a few times.
Oh, that side didn't.
Put your chin down just a little bit and say E.
E.
Just treating her neck bands. And E again.
E.
Good. Come together. Just there. E. And again. Very good. There you go. Stop now. First down. And relax. Poke. Turn your chin this way just a little. Pucker for me. And relax. We're just going to treat your chin to keep it nice and smooth. Okay. Make sure you come. Poke. Just finishing up with our neuromodulator now. Poke. Frown for me, and then relax. And then raise your eyebrows up for me, and then relax. Turn your head this way though. Raise your eyebrows up again and relax. And up again and relax. And up again. And relax.